The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm excited for today's guests. Like so many guests that we've had lately, it's just been an awesome run of great people that we've had on the program, and it's going to continue today. From All-Star Dental Academy, we have Larissa Pretoni. Larissa, say hello to everyone.
Everyone.
Yeah. I always start the same way as you know, a little bit of background. Tell me, how'd you get involved in dentistry? How'd you start working in this industry?
Right after high school, that was about 22 years ago. We don't have to know my age, but I started as a dental assistant, went into front office management, and then I'm here today coaching and consulting.
Yeah, so that's fantastic. I know that the All-Star has some amazing coaches and programs. So a ton of knowledge you're all sharing with each other, meeting with literally hundreds of, maybe even thousands of dental practices across the country. I know I'm going to see you guys in person here. I don't know if this episode will air on time, but it probably will the third week of October up in Portland, Maine for a great event there. I'm excited to attend and learn a lot myself. So thanks for being here. Yeah, let's just jump right into it. What's going on today? What are some of the challenges and problems that you are seeing dentists facing, that they're coming to you, that they're struggling with? What's going on out there?
So, there's not one, two, or three, but, if we can pinpoint a few, one, we look at turnover, very high turnover rate.
Right.
Looking at lack of training, a big problem in dental offices, finding the time to do it, the right tools to use, and really patient retention is really being one of the biggest problems that we are seeing in the industry today.
Yeah, you said patient retention, correct?
Yes, patient retention,
Yeah. So which one of these you want to tackle?
Ooh, so this is juicy. Actually, looking at patient retention is really something that I'd love to talk about today.
Yeah, I'm glad you picked that. So tell me, what is the problem with patient retention today? Why do you think a lot of dentists are struggling with that when they tell you that, hey, we're not getting a lot of patients back in? What's the first point of data that you always look at?
So to me, it goes back to communication, effective communication, and really training your staff members. Your team members must know what to do when difficult questions arise. Patient retention starts with your phone call. If your team members are not well trained on that, first impression that they have from the office, you start building a trust factor on the phone call. So it starts on the phone call. That's usually where we go first.
So amazing first phone call means amazing first impression. If something kind of goes a little sideways, when they come into the office or maybe on their third visit, they still have that great first impression, right? So maybe they are a little upset or they've been kind of put back a little bit, but overall it's still pretty good compared to if they didn't have the best first impression on that first phone call, and then their first impression, or we call it their second impression inside their practice, isn't so good. You may have lost that patient. Does that sound right?
You're right. And then, from the phone, you look at your environment, you're clean, you're neat, it doesn't have to be extra modern, but at least have to be a space where your patient feels comfortable in. You're making sure that, you're communicating well. And again, communication is the biggest problems. One of the biggest problems we see, patients being set on time, and then really just relaying the dental message to the patient properly. That right there, that's where, you start losing patients.
Yeah. So if you took 1,000 dental patients and interviewed them and said, outside of your time in the actual dental chair, right? So outside of having any treatment done or any cleaning, what have you done, what do you like least about your experiences with dental offices? What do you think that would be? What do you think they would mostly point to?
So a lot of patients feel being sold to. I don't know if that's where we were going to go, but that's where, I see a lot of patients saying that they don't trust the dentist, and for that matter, they don't accept treatment, and that leaves a bad taste in their mouth. Just really the whole process. They come in, they haven't been to the dentist in however many years, and we will find out things that they don't want to hear. So if we don't know how to give that message and making sure they understand that we're for them, not against them, that becomes a problem.
Yeah, I one time heard someone say, that pretty wealthy individual says it feels like every time their dentist comes in the room after a cleaning, that they are using a tool to dig for gold, is what he said. They're using the tool to dig for gold. I don't know if anyone else has heard that or not, but I thought it was pretty funny. But it is actually how this person feels, right? That's what the dentist is doing, is just trying to find something to treat. When you talk about not selling the patient, right, give us some tips on there. So how do you present treatment without making the patient feel like they're being sold?
So I always like to talk about their objection. Patients are always going to be like it's either money, time, or they're afraid of the dentist. But really behind that, I think it's a lack of trust and really a lack of understanding why that treatment needs to be done. So when presenting treatment and understanding, using that effective communication, active listening, know where your patient is coming from, build rapport. You can't skip that step. If you do, they are going to feel so too. And also, I'm sure you've all heard push and pull dentist cells. So you don't want to be on the pushing side of the cell, if you may, because this is a word that we're all afraid to hear in dentistry, cell. But what is a
Right.
cell, right? You're providing a service and you're being paid for it. So we do sell in dentistry. It just depends on how you're doing it, if you're doing it with integrity or not.
Sure. Right. I mean, there's such a thing as selling people on literally life or death treatments, right? There's people that are on the side of the road bleeding, and an ambulance driver has to sell them on getting into the ambulance, right? I mean, this literally happens. You're literally saving their lives, but you're trying to convince them to do that. If somebody's bleeding out their side, it seems like it'd be a little bit easier than if, maybe they have a cracked tooth that is probably going to need a crown or needs one now or is going to within a couple of weeks. So that makes sense to me. You mentioned building trust with the patient. I think that happens from that first phone call or on. But if you had to say 3 different things that you could do today, like that your practice could do today to start building better trust with your patients, what would those 3 things be?
So hear your patient out. Don't assume anything. We're so quick to assume that, an objection is a no. We're so quick to assume that they don't have the money or it's expensive. And we have to remember it's all based on our own beliefs.
Yeah.
So treating the patient as not as you would want to be treated, but treat them the way that they deserve to be treated is something that I think it's important, and just really get out of your own self and listen out, hear out. That's a big thing. It sounds easy, and it is the first step. It's easy, but really being there. Second step is understanding how to ask questions.
Mhm.
Asking effective questions makes a whole, your game is changed. It's very different to ask a patient if they understand treatment. You don't want to lecture your patient. You don't want to sit there and say, this is what you need and sign off here, right?
Right.
You want to make sure they understand from a perspective that most patients are afraid to say they don't get it. They don't
Right.
want to
Yeah.
dumb, right? So asking the right questions. And there is one question that I always like to train my offices is, how do you feel about this? How do you feel about what I just told you? Does this
Right.
make sense to you? Just giving them the room to think about it and make the decision. And we have to remember that these patients chose us for a reason. They chose us because they believe us to be the best dental professionals out there, and they expect to live healthier than when they got there.
Right.
And not always are the way that we're going to make them healthier is what they expected.
Right. Yeah, that makes total sense to me. As I mentioned before, Larissa, one more time, you're with Dental All Stars. AllStarDentalAcademy.com is the website. You can go there. There's some awesome courses that you can sign up for and learn more. Like I said, you guys do live events as well. That's something for people to check out. Let me ask you this question. I'll be as non-biased as possible. I know you guys are great at what you do, and you know that too. But if somebody's looking for some help to help with case acceptance, if they're looking to improve with client communications, which those 2 things obviously go hand in hand, how do you go about vetting an expert to help you with this? There's a lot of people out there that claim to be, gurus and what have you, but how would you vet someone to work with you and work with your team to help you become an all-star?
So the first thing is I always take a step back. Like, how do you know you need help, or how do you know you can use help? The dental business does not have to be stressful. It doesn't have to steal your whole life. So if you feel that being a dentist owner is taking a toll on your personal life, on your physical health, on your emotional health, we can help you. There's professionals out there that can help you. And if you're trying to grow and you've been trying something a way that's not working, then you can also use help. But how do you choose that professional?
Right.
Ask questions, ask your peers. Dentists love to share their experiences. So one, ask questions, ask people that have worked with these professionals before. Google. Google is, such an easy search engine to use. And you can see a lot of reviews online nowadays, which makes it a lot easier to choose a professional. Another thing that you can do is get on discovery calls with different professionals. You can't make a decision just by looking at a website, or if you don't feel comfortable making a decision based on what someone else told you, actually get on these calls with these professionals and make sure you find one that speaks your language. There's so many different professionals out there, and I'm sure there is going to be someone that can help you, but you need to make sure that it's a match to your office, it's a match to what you're looking for. So I think these steps definitely will help someone make a decision.
Yeah, it's fantastic. I'm going to put your website out there. I know on the homepage of your website, if you go under dental coaching and scroll down, you can find more information about Larissa and the entire team at All-Star dentalacademy.com. I want to invite our audience to check it out one more time and keep an eye open for their live events too. Larissa, thank you so much for coming and sharing with us today. I appreciate your time.
Thank you for having me.